Although I've now written 14 books and have done research for the National Institutes of Health on diet and diabetes, and my whole family was in the cattle business. My grandfather was a cattle rancher. My uncles and cousins are still in that business. My dad grew up on a cattle ranch. And every day of my life, I ate roast beef, baked potatoes, and corn. Diabetes is a condition where there's too much sugar in the blood. The sugar is glucose. And glucose is not poison. It's supposed to be in your bloodstream on the way to get into the cells of the body where it acts as fuel. Glucose powers your muscles. Glucose powers your brain. Glucose is a good thing. The problem is in diabetes, it's not going into the cells. It's staying outside. It's circulating around in the blood over and over and over again. And it can damage the blood vessels, the tiny blood vessels at the back of your eye. They're attacked by high levels of glucose. The heart is attacked by glucose. The kidneys have blood vessels coursing through them, and they're attacked by this high blood sugar. And you have nerves going all the way down to your feet, and those nerves are nourished by blood vessels, and they're attacked also. So diabetes is a leading cause of loss of vision, loss of kidney function, abnormal nerve symptoms and nerve pain, and you have a 65 or 75% chance of having a fatal heart attack. That's the bad news. The good news is that there's a lot that we can do about this, and I'll share that with you. Now, so many people imagine if there's too much sugar in the blood, don't eat sugar. And don't eat anything that turns to sugar, like white bread or starches. You know what I'm talking about. This is typical diabetes advice, right? Mm-hmm. Well, if you look around the world, those populations that eat the most starch, I'm talking about rural Japan. What's the dietary staple in Japan? Rice. They're eating rice all day long. There's lots of carbohydrate. And yet they have much less diabetes in Japan than if a person moves from Japan to Vancouver or Seattle or Chicago or Vero Beach. Their risk of diabetes goes up 400%. They are no longer eating rice. They start eating cheeseburgers and cheese pizza and fried chicken, and they get more diabetes. Carbohydrate is not the cause, and it never was the cause of diabetes. And a low-carbohydrate diet is very limited in what it'll do for this condition. You know that's true. If you look within this country, vegetarians have less diabetes than non-vegetarians. So our first diet trial, we used a vegetarian diet. We used a vegan diet. Diet means totally vegetarian. No meat, no dairy, no eggs. And we also kept oils really low. And we compared that to a diet following the American Diabetes Association guidelines. And you know what that is. It's don't eat too much carbohydrate. Try to keep the carbohydrate fairly stable from day to day. Don't eat too much fat. And if you need to lose weight, cut calories. Well, we did a head-to-head test. The vegans won hands down. Their blood sugars dropped more, their weight dropped more, their cholesterols dropped more, and despite the fact that it was a small pilot study, the results were significant, and so we published them in 1999 in a journal called Preventive Medicine. You know, a lot of people do ask me about fish. They say, fish has good fat in it, doesn't it? I mean, that should be all right. Fish has good fat, but you know what? Your waistline stores good fat just like bad fat. It weighs the same. In fact, it has how many calories per gram? 9. Exactly. It's called good fat. Omega-3s interfere with clotting. They have an anti-inflammatory effect. But fish has bad fat also. All fats are mixtures. You take any fish in the store, 15 to 30% of the fat is plain old saturated fat, just like you can get in a pig or a cow. And there is sort of similar amount of omega-3. And people who have trouble losing weight on what they think is a healthy diet, one of the first things I want to do is take that salmon out of their diet. Chinook salmon is 50% fat. And so many people are carrying their good fat over to the bathroom scale in the morning wondering what the problem is. Okay. Many people imagine, well, if I'm not eating red meat, let's say I eat more white meat, I ought to be doing okay. Let's eat chicken. Well, here are the bad numbers. The leanest beef my Uncle Harold can raise is 29% fat as a percentage of calories. The leanest chicken is about 23. That's without the skin, without the dark meat. A bean is 4% fat. Broccoli is about 8. Rice is 1 to 5. And they don't have cholesterol, whereas chicken, fish, beef, they've all got cholesterol. So I cannot reverse your diabetes. Convenience foods that you can eat. Or if you're going to a restaurant, you'll figure that out. Take a couple weeks, just figure it out. An Italian place, they'll serve you pasta marinara. A Chinese place has lots of vegetable dishes which you can eat with the rice. Yes, you can eat it with the rice. Get brown rice if they've got it. If they don't, eat the white rice. It beats the socks off Spam. If you're at a Japanese restaurant, don't have the fish sushi unless you're very well insured. But you can have the vegetable sushi and the miso soup and the salads and things. If you're at Mexican restaurants, skip the meat taco, have the bean burrito. Hold the cheese. That goes for Taco Bell if you want to. I'm not saying it's the pinnacle of culinary art, but it's okay. A man was in Mobile, Alabama. His name was Bill. And he was a truck driver, and he called into the radio station. He says, I'm on insulin 3 times a day. I'm not in good control. I can't really control what I eat. I said, well, where do you eat? He said, Taco Bell, Burger King, and whatnot. And I said, well, have the veggie burger, and at Taco Bell, have the bean burrito. And at a grocery store, they've got a salad bar there. And it's not just lettuce, it's 3-bean salad and chickpeas. Load up on that, put that in the cab of your truck. Buy some oatmeal, old-fashioned oatmeal, and a glass bowl. And just microwave it. 3 minutes, it's ready. Okay. He said, I'll try it. 2 weeks later, I'm back at my desk in Washington. Phone rings. It's the same radio station. He said, can you go on the air right now? I got Bill on the line. And Bill said, this is the most amazing thing. I woke up this morning, my blood sugar was 62. If you don't know those numbers, that's low. And I said, well, Bill, I'm delighted, but I'd like you to call your doctor because you need much less insulin. He said, oh, I did that last week. His blood sugar plummeted right away. And it was already too low, and he needed less and less and less medicine. Now, part of the reason I say this is I want to encourage you to give it a try. The other reason is I want to warn you. We're not fooling around. This is a serious diet. And if you're on serious medicines that have been endeavoring to push your blood sugar down, and suddenly your diet gets out of the way, your blood sugar can really fall. Now, if you're on diet alone, or if you're on metformin alone, or if you're on Actos alone, these are medicines that will not likely cause hypoglycemia. But if you're on insulin, or if you're on a sulfonylurea, this means glipizide, glyburide, glimepiride, you're going to become hypoglycemic. Very likely. Now, this is not bad. This is good news. You'll be happy when it happens, but I want you to be prepared. And by being prepared, tell your doctor before you start the diet that you're making a big diet change, and keep your doctor's number handy. Keep glucose tablets around or something else in case you get shaky so that you can take you can take them to bring your sugar back up temporarily. The other thing is take a multiple vitamin. You'll get plenty of protein from vegetables. I'm talking about beans, grains, vegetables, fruits. You'll get adequate protein. You'll get plenty of calcium from green leafy vegetables and beans. But vitamin B12 is something that you need for healthy nerves and healthy blood. There are not a lot of vegan sources. There are some. Nutritional yeast, fortified cereals, but you're probably ignoring those foods. So a multiple vitamin covers you for that. And frankly, your nutrition is going to be much better on a vegan diet because of all the vegetables and fruits and beans and fiber that you're getting. Step 2 is take it for a 3-week test drive. Not forever, just 3 weeks. But during these 3 weeks, don't stick your toe in the swimming pool and think, well, I'll try it a little bit. I'll have a healthy meal on Tuesday and one on Saturday and one the No, don't do that. Do it every meal, every day for 3 weeks. Even if you get an obstacle, like you got invited to Outback Steakhouse, you do it there. They've got a vegetable plate for you. Why do I say this? First of all, it's a great learning experience to see how to eat healthy, even in the face of life's challenges. Secondly, you're going to feel what it's like to be on a healthy diet. You're going to see your weight start to come down. Your blood sugar get better. Your blood pressure is coming down. If you've got a monitor, check that too. Your cholesterol is starting to come down. It's not all the way, but it's coming. And the third thing is, your tastes will change. What if, for 3 weeks, you lighten up the whole diet, and you do a vegan diet for 3 weeks? Go back and have a double bacon cheeseburger. You'll discover it's not the joyful experience you remembered. And your taste will have changed, your outlook will have changed, but that will never happen if you don't actually allow yourself to experience it. Most people go their whole lives never having even a week on the foods that their bodies were designed for. Give it 3 and see what happens. At the end of that time, if you don't like it, you can go back to the foods that caused your illness. Or you could stay on a regimen that helps lead you toward health.